Now, I may feel like I'm hallucinating as I recover from this cold. And for those of you who watch this or know me on social media, I normally don't sound like this. I'm recovering from a cold. I may feel like I'm hallucinating sometimes, as I'm recovering from this cold. But what I'm definitely not hallucinating is the outrageous price gouging that you all have been experiencing when it comes to urodynamic catheter costs. They are just outrageous, and it's infuriating. Anytime that there's a disruptor or a competitor in this capitalistic system, I am all for it. I'm a great benefactor of this system, and the capitalistic system has brought up more people out of poverty, including myself, coming from Taiwan into the States when we had literally nothing. In this video, I'm extremely excited to feature a company called Gemini MedTech, and I have Brian Hirsch and Dr. Elizabeth Babin in Florida to discuss their Atmos air charge catheter that is already disrupting the urodynamics catheter market. And I will have to cover this in a separate interview. They also have a full line of urodynamics products. So welcome, Brian and Dr. Babin.
Thank you, Dr. Lin.
Yes, thank you.
John,
we're excited to be here.
Excited to be here.
Tell us about this. What made you decide to start this company and go about doing this?
So we started this company about 3 years ago, and we realized that the marketplace had become really monopolistic in the urodynamic space, and we saw the rising prices. Since 2019, since the competitor product came off patent, Labrie has raised the price 130% in 4 years, and that was going through the COVID crisis when many elective procedures were not able to be done. So we were building our company, and we did our official launch in June of last year and our soft launch in March of last year.
And I can just add that, I'm a practicing female pelvic medicine and reconstructive surgeon, and I felt that restriction on practice and seeing your your profit margins going down, and the increase in the cost of catheters, and the service that we were receiving for our machines was reducing the amount. When you have so much turnaround, you need a lot of support, and we weren't getting as much support as we had in the past. And we really didn't have any more options, because they went and they brought together so many and bought out so many of the competitors. We just didn't have options, and so that was a big driving force for this launch and this company.
So, Brian, you said something that is key: the monopolistic tactics that Labrie used. I'm happy that they were big enough that they're able to buy up these other manufacturers, and I'm really glad that they're doing so well. But then to leverage that and just jack up prices when the consumers have absolutely no choice. Not only that, if they increase the prices, and if their support, and to your point, Dr. Babin, if the support was on par with the upcharge, then the consumer doesn't feel so ripped off. But that is not the case. Not only did the price increase, you got worse service with the same product. So I'm so glad that you guys decided to start this company 3 years ago, and I'm glad you guys are doing so well. So tell us about these catheters. My audience in the Thriving Urology Practice Facebook group, everyone's got the same questions, right? They want to know about compatibility. They want to know about the cost.
Yeah, for sure.
Sure.
I can speak to the compatibility. That was one of the main goals for us, and reverse engineering of the air charge catheter. We wanted to make sure that there was no hassle to bring it into your practice. So it is completely reverse compatible with a system that is calibrated to any air charge catheter. And we wanted to be sure that, you could plug and play. So you can, go ahead.
So if I can interrupt you, basically there, as far as I know, there's Library and there's Prometheus, and now that I know that there's you,
Yes.
right? So there are 3 urodynamic machine companies. You're saying the Atmos catheter is compatible with all 3?
As long as you are calibrated and using air charge in your practice currently, you will be able to hook to those same TDOC cables and be able to run air charge systems. We also have cables if you don't, but if your machine is calibrated for air charge system, you'll be able to use our catheter.
There are a couple exceptions, and that's one of the topics we'd like to talk about today as well. And that's what the competitor is trying to do to stop allowing consumers and practices to have a choice. And that is going back and offering a free upgrade to the system. And it's not truly a required upgrade. And when they do that, they're trying to lock out your choices.
Wait. Let me guess. Are you talking about what Library is trying to do as far as the add-on that they're doing so that it requires you to barcode scan the catheters?
That is correct. They're marketing it as a way to make sure that the products are being single use. But for 20 years, the competitor product has been sold in the United States, and there was no need to ensure single use by the manufacturer. When we came to market, they accelerated a program to try to lock us out of the market and take away the consumer's choice and continue to do these price increases. And we didn't just come out to the market with a cost-effective product for the practices, which is saving about $80 per study, but we also made sure it had enhancements over the existing product. And we can speak to those if that's something you think your viewers would like to hear about.
So let's cover that just a little bit later. Talk to me more about the cost savings relative to the existing pricing structure by Library.
Okay, sure. Thank you. So we did a lot of market research, and when we did our official launch last year, we came to market 35% lower, which was about $200 and $300 per 10-pack box for single sensors or specialty catheters, respectively. And at that point in time, in March of last year, we made a commitment to do no price increases at all through at least December of 2024. That meant no price increase at the beginning of this year and no price increase in the beginning of next year. So groups that came on board with Atmos and Gemini so far have had, to date, over 2 years of price stability going into the future with us. So once again, we did not increase prices this year, but our competitor, which surprised us, we thought that they would pull back. They took another 15% price increase as of January 1st. So now our product, their list price to our preferred customer pricing, which is what we offer to the market, we're 45% less expensive than the competitor products, which equates to about $80 to $85 per study.
Wait, 45% less?
That's correct. We came to market at 35% less and held our prices steady, and they took another price increase.
That's just great. That's why I love you guys. And I hope, you're maintaining this pricing structure until 2024. Hopefully you can continue to maintain that favorable pricing structure as you go forward.
That's our goal. The only increases that we potentially would ever take would be inflationary, but we do not plan to gouge our customers. We have, as part of our vision and in every slide deck, premium products at responsible pricing and partnering with practices. We really want practices to feel that they have a urodynamics consumable and equipment supplier that is partnering with them to give them premium products and not gouge them at the same time.
Yeah. And it's one of the important parts of the commitment that I have in being, a founder of this company, is to make sure that I'm one of these guys. I know the pain that everybody is feeling, and I'm really, really, committed to making that our priority.
That's great. Let's hope we never lose that vision as founder and co-founder. So let's talk about the quality of these catheters.
So from a quality perspective, we have everything manufactured in Italy. It's a company that's been around a very long time. They're not new to manufacturing for urodynamics. They've been manufacturing urodynamic specific catheters for a very long time. And the quality, we've increased the quality of the, it's a polyurethane, so that's an improvement. It softens in the patient's body. We've decreased the size, and we did an extensive amount of studies during the process and development before we would come to market to ensure that we were getting accurate pressures, that we were able to connect into the docking stations and get adequate charging, and that we were having stability during studies. So we've gone through an extensive amount of testing to ensure the quality.
It sounds like what you're saying is that not only did you make it cheaper, you made it better.
Yes.
Yeah, so I'll speak to this for a second. I can sum it up in really there's 3 topics. The first one was we wanted to come out with a catheter that was going to give the patient more comfort during a procedure that typically is an uncomfortable procedure and a scary procedure. So we have a true 6 French catheter. The competitor markets their catheter at 7 French, but if you measure it, it's actually 7.8 French. So it's an 8 French catheter, although it's marketed as 7 French. So internally, we like to say we're 2 French sizes smaller. If a physician holds up the competitor catheter and our catheter side by side, they can visibly see a difference in the 2. And as Dr. Babin said, we made it out of a material that was more soft and actually at body temperature softens. So it's rigid enough to go into the patient, but once it's in the patient, it softens. So that's the first topic, and I'll pause there for your question.
So what I'm doing right now is I'm going to switch over to a live view of your Atmos single sensor bladder air charge urodynamic catheter labeling. It's 1B-AC. And there's another one that I'll feature here. 1CB-AC. This is a coude tip catheter. So I'll bring the end here. There's a nice coude tip catheter, and it's really, really small. So quality packaging as usual, as expected. And as you said, this was made in Italy. It says that I'm showing the label saying that it's manufacturer records in Florida.
That's our corporate headquarters. Yeah.
Yeah, it's a U.S.-based company, right? And it sounds like it's coming from a manufacturing plant that is not some third world country.
That is very correct.
That is correct. And Dr. Babin alluded to quality. So what I'd like to just touch on that. In our manufacturing process, every single catheter is 100% tested for leak and to also leak bond, and to ensure that if it's an infusion catheter, there's no occlusion of the filling lumen. And then every single lot is performance tested as well at multiple pressure readings to make sure that it's accurately reading the pressure that it's supposed to be reading.
It sounds like we don't have to worry about the quality. We can just open it up, hook it up, calibrate it, and use it.
I know. I'd like to correct you. There is no calibration required if the machine is already calibrated. We made it fully backwards compatible. We did a study with almost 2,000 data points, which you can find on our website and in our marketing material. It was reviewed by a third-party statistician, and what they found is near perfect correlation on equipment that was calibrated to a TDOT catheter. They can take our catheter out of the packaging and use our catheter on that machine without any recalibration. In fact, many of our early customers, as they were using up their inventory, they had different inventory levels of different product codes, and there's 2 catheters in every study, as you know, so they would use their existing stock from the competitor catheter for one of the 2 catheters and ours at the same time for the second catheter till they depleted their original stock from the competitor.
Sounds like what you're saying is not only do you have this third-party validation from a different company to evaluate your product to make sure it's backwards compatible, you also had your customers who are using your products right now telling you that they also see the same correlation.
That's correct.
That's correct.
Well, I don't see any reason why anyone would want to continue using the Labourie's catheter when they have this option. Who are your other competitors? Does anybody else, am I missing something? Does anybody else make these air charge catheters?
In the United States, we're the first company that was able to come to market with a reliable air charge catheter. We are the only other company that's selling air charge catheters in the United States.
Now that we know that is better, cheaper, cost-effective, clinically relevant, and clinically efficient, how do people purchase these catheters? Do they contact you directly, or do they go through a third party? I know UroGPO started carrying these recently.
So two good questions. First of all, we, before launch, made sure we had robust manufacturing and that we had a warehouse fully stocked with inventory. Our catheters also, and we have pump tubing that will also work with the competitors' equipment and our new line of equipment. And electrodes. So all the consumables required for a study, they can purchase directly from Gemini at orders@GeminiMedTech.com or via phone, and we can provide that information, and it's on our website. We also have now over 40 field-based sales representatives across the United States that are talking with customers, and we're having significant month-on-month growth. So we have no concerns about stock outages in the future. Our manufacturing is robust. We have no supply chain issues. And so customers can feel very comfortable switching to Atmos and not worry about price increases in the upcoming years, nor stock outages from our manufacturing or warehouse.
Yeah, this sounds like a proverbial no-brainer. And I'm showing the audience the pump tubing. Pump tubing 3.2 by 6.4 millimeter. It's just your standard pump tubing. That's why I didn't really show it initially. It's just a standard tubing. And also the abdominal, the rectal catheter, I believe. It's just your standard rectal catheter. There's really nothing exciting to show about the rectal catheter.
So currently we have 4 product codes. We have your abdominal catheter, as you refer to it as the rectal catheter. We have the single sensor bladder catheter, the Coude bladder catheter, and we have the dual sensor urethra bladder catheter. We have coming out in the next month or two, the radio opaque for video urodynamics, both single sensor and dual sensor.
Sounds like you're covering all bases when it comes to a practice, your urology practices, your dynamics needs. You're like the one-stop shop. Even if your machine breaks, you have that covered. But we'll discuss that and cover that in the next video.
Okay.
Excellent.
And anything else that you would like to discuss or cover at the end, at the conclusion of this interview?
Yeah, just one last topic, which you alluded to. As of January 1st, we are the preferred vendor for the urodynamics products for UroGPO, and we also just became for, which is predominantly in the southeastern United States, Genesis Care. We became their preferred supplier for their members as well for the urodynamics products. And then I guess those are 2 very important points. Your viewers will see us at almost every convention, both in urology and urogynecology this year, as we're going to be at 7, I think, between March and May. And then the back half of the year, we have many more planned as well.
That is great. Go ahead, Dr. Babin.
We look forward to the viewers trying our catheters. We look forward to seeing them at the conferences. Come by our booth. And we love feedback. So if you try the catheters and you want to give us the information, we want to take down that information and keep track of it and keep making and improving the products.
Well, I'm all for a company that is empathetic to the customer or the audience, and that you are listening to what the customers want and addressing those needs. So it sounds like you came into a market space that is in need of a competitor, and I'm so glad that Gemini MedTech is doing so well 3 years in, and I wish you the best of success and continued success in your ongoing venture. We sorely needed you being in the space, and you guys are international now. So great job.
Thank you for
Thank you
having us
so
on
much.
today.
You bet. All right. And for those of you who are watching this, I see some comments. Dr. Farid said, so the website only allows contact form to be filled in order to be in line for early access. So the product not available at current time? No, the products are currently available right now for everyone and anyone to use. The fact that I have, let me show you what I have. I've got the catheters. I'm literally holding in my hands the catheters and the pump tubing. This is being shipped internationally, so it's available right now. So ordering information, you can order through EuroGPO. I'm happy to leave their contact information, and you should be able to access these through Gemini MedTech, and they'll make sure that you can have access to these products in the most efficient way possible. All right, I see no other questions. Thank you so much for watching. Really appreciate the privilege of your time. Take care of yourself and take care of each other. Bye-bye.